Hi, everybody. Welcome to our Facebook video. Today, we are celebrating Nurses Week. So excited to have Kristin Williams join me today. Kristin, thanks for taking time to talk with me. And happy Nurses Week, first and foremost.
Thank you.
So, Kristin, you are the Director of Clinical Services, and you oversee clinical services in Hospice of Charles County, correct?
That is correct.
Awesome. So I'm going to give a little backup. Hospice of Charles County has recently, back in October of 2020, become part of the Hospice of the Chesapeake, as a Hospice of the Chesapeake affiliate. So part of the Hospice of the Chesapeake family. So just for anyone that might not be aware of that. So we are so excited about all the services and everything that you do and nurses do in Charles County. So let's start there. Tell me a little bit about your role as the Clinical Services Director. What do you do?
Sure. My role as the Director of Clinical Services, I currently oversee the program of hospice at the Hospice of Charles County. So we offer inpatient, which is here in Charles County.
Okay.
We have outpatient services. We do have a hospital liaison that goes to the hospital in our area. We have social workers, chaplains, home health aides, as well as hospice aides in the inpatient unit as well. So
I'm going to back up. I want to back up just a little bit just to get some. So are you an RN? Like, what's your nursing background?
Yes, I am an RN.
Okay.
Yes, I started in acute care as an RN on
Okay.
the unit. And then when I came to this area, because I am originally from Pennsylvania, I came to long-term care in management at a veterans retirement home.
Wow. Okay. And now your path has sort of taken you to hospice. That's cool. All right. So that's one role, I guess, that we can talk about is a management role that's kind of different, than what some people might expect or understand that a nurse does. You briefly mentioned the inpatient care center, and I know there's been a lot of refreshing going on at the Waldorf Inpatient Care Center, a lot of updates. Start with that, but then I do want to go to talking about what nurses do there.
Sure, it is beautiful. It has always been beautiful, but since becoming an affiliate with Hospice of Chesapeake, we've changed our logo a little bit. We still have the Hospice of Charles County logo, but just changing it and combining it since we are affiliated,
Right.
we want to be associated. We have new carpeting, fresh paint, new beds, new bathrooms. There was a renovation project and it looks really beautiful because our administrative offices are on the second floor of our inpatient unit.
Okay, it's all in the same building. One of the other things I wanted to ask about the inpatient care center is the role of the nurses there. So what would a nurse do when they're working in the inpatient care center?
Sure. So much like a hospital, you receive assessments, they receive medication, but there is a little added personal touch. The nurses are there 24/7, so around the clock. So there's a kitchen area. If families bring food in that they want prepared, it's individualized. They can eat what they like. And so the nurses will go, they work with the CNA who is there that, help bathe the patients, range of motion for the patients, just sitting and having, presence with the patients, just being there, even if it's, just talking with them, making them feel more comfortable, singing, but they care for them 24/7.
24/7. So that's the really big difference. The setting, the location of it, that it is sort of the, instead of having to go to a hospital, it is the place that you can go to manage symptoms and have that 24/7 eyes and professional clinical team supporting you.
Yes.
Got it. Okay. All right. The other thing that when we first started talking that you mentioned was a hospital liaison, or a nurse, with the hospital. Can you tell me a little bit about what that role is, and
Yeah.
yeah, fill me in on that one.
Sure. So I like to think of a hospital liaison as kind of an educator, right?
Okay.
And they educate the hospital because the exposure that you get to hospice in a hospital is much different than being in hospice. So many times, physicians, any clinician doesn't really know what goes into hospice. So the hospital liaison is there to educate them. Additionally, the hospital liaison is also there to follow our patients and also bring potential patients onto service.
Gotcha.
So they really are a liaison between the community, the hospital, and hospice.
So they're educating not only the medical providers that might not really understand the full benefits of hospice, but also the patients and their families that are there as well. Okay, sort of that
Yeah.
hospice is an option and what that means.
Yes.
Okay.
And also, sometimes we get patients on service who are just too ill to make it out of the hospital, but they can still be on hospice service. And if we have someone who is on hospice service in the hospital on our GIP level of care, that liaison is also the person that would conduct the assessments, really
Okay.
see that patient, and
Okay.
visit them daily and do daily assessments.
Got it. So that's fabulous. Then we've just created a new partnership and have this position established with the University of Maryland Charles Regional Medical Center. So that's really exciting that
Yes,
we've been able to establish that and have that position. That's
absolutely.
awesome. That's awesome. So, any other nursing roles? We've talked about the inpatient care center, we've talked about the hospital liaison. Are there any others, roles, sort of, or even responsibilities that you think folks might not be aware of that nurses do for hospice?
Sure, absolutely. We also have outpatient, as I said earlier, we see patients where they are, what they consider home.
Right.
So they can be in a long-term care facility. And, many times you have nurses there 24/7, but the medications that we're able to give, the education that we're able to give, the security of just knowing like it's okay to have this illness and remain at home,
Yeah.
the nurses will go there. So minimally, the nurses who see patients outside, like in their home or in a facility, the
Hmm.
minimum requirement for them to see them and do an assessment is 14 days. But that nurse is there with the patients, with the family, with the staff to also educate them on how to care for the patient when we're not present. So they can call us with any changes and those visits will increase. So depending on, what is going on with the patient, sometimes they are seen twice a week by the RN. And when they're off, we also have an RN who is available after hours.
Okay.
So much like the inpatient unit, they are still able to receive services 24 hours a day.
Right.
We are just not actively there with them.
Just not in. So on call, basically,
Yeah,
a phone call away
a
could
phone
be
call.
available 24/7,
Yes.
which I think is so huge. And anyone that I've ever spoken to that didn't really understand hospice until they had that service for their loved one has said what a relief that piece is, like, to not have to make decisions and to have somebody who's clinically, professionally, medically trained to be the eyes and ears and the, guide them,
Yes.
that it's takes such a pressure and burden off of the family members. Yeah, I
Yeah.
think that's such a huge role. And so with that role of nursing and everything that's happening in hospice of Charles County, we've been able to expand capacity of for admissions, right? Like, we're able to enable more people to access hospice services and care. That's
Absolutely.
awesome. That's
Absolutely.
awesome.
Admissions happen 7 days a week. They happen in the evening. It's, we really work to get them on service.
So I mentioned, and we were just talking about, one of the misunderstandings are like realizations that people get when once they do have somebody who's starting to receive hospice care, is sort of this connection with the nurse and how much support that gives them. Have you, in your experience, what are some other sort of aha moments or misunderstandings that people kind of come to realize after the fact, and they're like, man, I wish we had done this sooner, or I wish I knew that?
Sure. You know, in the times of this pandemic,
Oh yeah,
we
we didn't even
really,
touch on COVID.
yeah. And even before that, but it really stands out in this pandemic. To be on hospice, there is criteria. So you have to be terminally ill, and the life expectancy for that is, 6 months or less. Sometimes patients live longer than that. Um, but with people being hospitalized, there was really no visitation for a
Right,
while.
right,
So your loved one is in there, pretty much alone. Like maybe if they're well enough, they can Skype you, Zoom you. But with this, you get to be at home. You get to be with your loved one. You get to kind of be their medicine, being their family, like
right,
not an oral
right,
medication, but just being there with one another. Um, when these patients elect to be on hospice, if it's their choice, that's another beautiful thing, right? Because sometimes the disease takes over and you feel like you have no control
right.
as the patient. And this decision, making the decision to sign on to hospice, I think a very powerful decision, because you're like, this is how I'm choosing to live.
Right,
Not say how I'm choosing to die. This is how
right.
I'm choosing to live.
Yeah,
And you get there, you get to be surrounded. So I think that that is something that people really don't know.
yeah,
Um, and I know, we're highlighting nurses right now, but I have to bring in the rest of the interdisciplinary team. A lot of people don't know that you get a social worker, you get a chaplain, you get a home health aide. And while they're not there 24 hours a day, we're here sometimes just to have presence, just to give
right.
that education, just to give you that extra security and like knowing I can do this. No, I'm not a nurse, but I can be a caregiver. I can care for my
Right,
loved one.
right. Yeah. And I think that's great that you brought in the rest of the team, because that really enables you to provide such quality care, because it's not just looking through one lens. You've got other team members who can bring their skill sets and their insights, and really be able to help a person from different angles, right? Like, I think
Absolutely.
that's huge. And yes, I'm with you. Let's celebrate nurses. I think, the nursing piece of it is phenomenal. And then to have those other interdisciplinary team members is just, phenomenal too.
Absolutely. The cliche saying is there's no I in team. It may be cliche, but it's so true.
Well, Kristin, thank you so much for taking time to talk with me today. I am so excited to have Hospice of Charles County be an affiliate of Hospice of the Chesapeake. I also want to make sure to thank the John and Kathy Belcher Institute for their generous support of the community education programs at Hospice of the Chesapeake. Thanks.